For active range of motion for the shoulder joint, you would ask the patient to place hands in an anatomical position and bring arms upwards for abduction. Then test elevation through flexion, so ask the patient to bring their arms forwards. Extension, you would ask the patient to bring their arms backwards as far as possible. For external rotation, you would ask the patient to flex the elbow to 90 degrees and bring their arm outwards as far as possible. And for internal rotation, you would ask the patient to lift their hand as far up their back as possible. To test horizontal abduction, you would ask the patient to abduct their arms to 90 degrees, then bring their arms inwards. Then for scapular protraction, bring the shoulders together anatomically, and for scapular retraction, squeeze shoulder blades together. And then for shoulder elevation, you would ask the patient to bring their shoulders up. For the functional test for the shoulder joint, you would test abduction first, doing a lateral raise, which uses the anterior, middle, and posterior deltoid, the trapezius, the supraspinatus, and serratus anterior, which are around the shoulder joint. And then conduct a drop arm test for adduction, which uses the muscles pectoralis major and minor, latissimus dorsi, teres minor, and suprascapularis. So for passive range of motion of the shoulder joint, you test flexion, then extension. Then you would test abduction, bring the patient's arm up, and adduction, bring the patient's arm down, as shown. And you would do some resisted testing of all the same movements just shown.